Dr. Tasman Cordie with Sage Nutrition. And my top 3 nutrients I like to test for and make sure patients who have symptoms of depression have enough of are these. I like fish oil, I like vitamin D, and the third one is actually a pair of amino acids. They're called tryptophan and tyrosine. So I like using fish oil because, as we know, most of the brain and spinal cord is made of fat. And we want to make sure that as your body replaces itself, it's replacing itself with really good, healthy fats that your nervous system needs and wants to function properly. And those long-chain fatty acids that we find in fish oil are the best way to get those in. It's the most efficient and it's the most effective way to replace fatty acids in the nervous system so it can function properly. The second thing is vitamin D. Vitamin D is really a hormone or a prohormone. Vitamin D is involved in so many reactions in our body, including lots of reactions that have to do with how our immune system functions and how inflammation acts in the brain and in the rest of the body. So we know that getting vitamin D is something that we get from the sunshine if we get enough vitamin D on our skin, but a lot of us don't do that, especially in northern climates where we wear a lot of clothes and cover up all the time and wear a lot of sunscreen. And we can also get it in a variety of other places from vitamin D supplements. So it's an easy supplement to get, and it's a really easy number to raise on blood levels. So when we look at vitamin D on blood levels, when it's low, it's one of my favorite things to be able to change because it's such an easy thing to change and it makes such a difference in so many different ways in the body. And then the third thing is tryptophan and tyrosine, and these 2 amino acids are very important for neurotransmitters, which are chemicals that the body uses for a variety of things to happen, much like hormones floating around the body. Neurotransmitters are chemicals that allow our bodies to make serotonin and to make melatonin. Specifically, tryptophan and tyrosine are really important for those things, and they're also important for making energy hormones like adrenaline and noradrenaline. So we want to make sure you have enough of those. And of course, amino acids come from proteins. And if you have enough protein in your diet, essentially, we should think that you have enough amino acids, but that's not always the case for many reasons we can go into in another video. We won't do it here because it gets a little bit lengthy why people don't have enough protein. So those are my favorite 3: fish oil, vitamin D, and then tryptophan and tyrosine. So if you have any symptoms of depression, it would be a good idea to get your nutrients tested and then make sure you have enough of those to start. There are a variety of other things that we look at when we talk about symptoms of depression and resistant depression to make sure that we can get you through your symptoms and recover fully from the depression. But we need to start with fundamentally making sure you have enough nutrients on board to make those changes happen. If you have questions, let us know. We'll get you in for a free consult and we'll get you started on your path to recovery.